Some people are saying that ashwagandha actually makes them feel numb and emotionless. But does it really do that? Is that true? Is that false? What's the deal? What does ashwagandha do to your body? How does it make you feel? What do we know and what don't we know, guys? We are talking about that today. I'm Dr. Jen. It is good to see you. Let's talk about ashwagandha and what it is, first of all. Now, ashwagandha is actually a shrub. That is right. It's a shrub that's found in parts of India, Africa, and the Middle East. And it contains several active compounds that have been associated with some anti-inflammatory and antioxidant effects as well. Now, this is a thing. It's not new. Now, we might be seeing ashwagandha supplements all over the Googler Schmoogler these days, but actually it's been around for thousands of years. It's been used as a medicinal plant for thousands of years, especially in traditional Ayurvedic medicine, which is super important for you to know. So there's many cultures, many styles and practices of medicine, etc., that are familiar with ashwagandha. Now, currently, many of the supplements that are on the market right now, you might have seen this, are promoted for things like stress and anxiety, sleep, male infertility, and other things. And also, you should know that these supplements often contain ashwagandha root or root leaf extracts. Okay, so now let's talk about what we know. And this is important, guys, because I'm going to be citing some data that we have from the NIH. I love the NIH website, especially for supplements and things like that, because it does a really great job of summarizing kind of what we know and what we don't know. So this is what the NIH says about ashwagandha, okay? They say that many clinical trials have looked at the use of ashwagandha for a variety of health conditions, which, by the way, is good, because we don't always have that. But they do say that many of the studies have had small sample sizes and have used a variety of preparations of ashwagandha. Now, you might be saying, well, okay, so what? Well, let me just sort of talk about that for a second. Whenever we have studies that are done, if studies are small, it may mean that we can't extrapolate the results to a larger population, right? It may mean that we don't have enough people in the study to really fully understand, know, or be able to say what something does or does not do. So keep that in mind. The other thing is that when it mentions that there's a number of different ashwagandha preparations that have been used in the studies, that may also confound results as well, in the sense that if you've got different brands or preparations, forms, etc., of the shrub that you're using, you may also not be able to extrapolate a conclusion because everything can actually work differently, right? So keep that in mind. According to the NIH, research has shown that some ashwagandha preparations may be effective for insomnia and stress. So it might help not being able to sleep and being stressed out. However, the NIH goes on to say that evidence is unclear about its effects on anxiety. And that's important to note since there's a lot of companies marketing for that, okay? The NIH then goes on to talk about some other symptoms that people have wondered about. They say that there's limited evidence that suggests that taking ashwagandha for 2 to 4 months may increase testosterone levels and sperm quality. We talk about that because there's been a lot of talk about ashwagandha doing things like affecting libido or sperm count or testosterone, things like this. That's, I think, a really important thing to keep in mind, okay, especially for men. I want to just stop there, though, and say that this is not a blanket statement or invitation for men out there to start taking ashwagandha to increase testosterone, etc. I want to be complete in what we know right now, but understand this is not, I'm not advocating for you to go out and take it for that. You need to talk to your doctor. I'm going to go further on and talk about some risks, but you got to talk to your doctor. Do not just start taking it for that. Furthermore, the NIH says, and I think this is important, in terms of other conditions, things like asthma, athletic performance, etc., there isn't enough evidence to determine if ashwagandha is helpful for any other health condition, okay? So the two main things that there was some evidence for, just to summarize, is we've got stress and sleep, and then we've got testosterone and sperm quality, okay? Limited evidence and, conclusions we can make about anxiety. So I do want to mention that. I think that's very, very important. Now, I know I'm going on, but I want you to sort of understand what we know, and I'm also going to give you my recommendation about what I think about this. According to the NIH, ashwagandha may be safe when taken in the short term, like up to 3 months, but they do say that there's not enough information to allow conclusions about its long-term safety effects. So that's really important to keep in mind. They say up to 3 months may be safe. We don't have a lot of long-term data or are able to make long-term conclusions. You need to keep that in mind. And the other thing, they talk about potential side effects, okay? They say that in some people, in some individuals, ashwagandha preparations actually may cause drowsiness, okay? Keep that in mind. May cause upset stomach, diarrhea, and even vomiting. Remember, just because it's natural doesn't necessarily mean it's safe. That is something I say all the time. The NIH also then goes on to say that we have to remember that even though rare, there have been a number of cases that have linked liver injury to ashwagandha supplements, okay? Also, a few other cautions that you should to keep in mind. Ashwagandha should be avoided during pregnancy and should not be used while breastfeeding. And that's another important point that the NIH makes, and I wanted to make sure that, that you had that. Furthermore, ashwagandha is not recommended for people who are about to have surgery. This is according to the NIH, so keep that in mind. It is also not recommended for those who have autoimmune conditions or thyroid conditions either. And also, don't forget about the potential interactions with medications. Remember that any supplement can potentially interact with medications, either make them not work, your meds not work, or make them work too much to cause harm. That can happen, okay? And one thing we have to keep in mind is that, ashwagandha may, in some people, increase testosterone levels. For that reason, the NIH does go forward and say that people with hormone-sensitive prostate cancer really should avoid its use. So I'd love to know in the comments, like, if you've tried ashwagandha, if you're taking it, what you're taking it for, how long you've been taking it, what, how you feel on it, etc. I'd also like to know if you have felt that it has worked. This is not an endorsement for the supplement. I'm not telling you to take it. What I'm telling you to do, again, is to talk to your doctor about it, okay? And a lot of people say, well, doctors don't know about supplements. And the truth of the matter is, you're right, there's just a lot that a lot of us don't know a lot about supplements. And you're right, the medical community has a lot of, we have a lot of learning to do, but your doctor is going to be able to give you an educated sort of decision and discussion about potential side effects and interactions and how it may affect you. If you got a thyroid condition or autoimmune, remember all these things were mentioned. So don't just assume that your doctor doesn't know anything about it and that it's useless to talk to your doctor. Anyway, I know that's like a mouthful, but I needed to say that because that's one thing a lot of people respond to me saying, well, doctors don't know anything about these. Well, we may not know everything about supplements, but we hopefully will be able to guide you based on your individual profile. So let me know what you think in the comments. Let me know if it made you feel dull or sort of numb or whatever the case is. Let me know if your doctor also recommended you not take it. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos. Guys, thank you on Facebook for liking and following my page if you haven't already. For those of you who send stars, I respond personally. Also, consider joining my subscription group, Dr. Jen Superstars, for exclusive content on YouTube. Please subscribe to my channel. Click the little bell for updates, and go to Dr. Jen Caudle for drjencaudle.com for updates and for also all sorts of stuff. Okay, guys? All right, y'all. Love you. Bye.